From the California State Senate, this is Senate Spotlight.
Hello, everyone, and welcome to this edition of Senate Spotlight, where we discuss legislative priorities, policy, and other related issues with members of the California State Senate. From the state capitol here in Sacramento, I'm Brian Green, and this time around we're going to be discussing young people's pernicious exposure and access to tobacco and legislation that would limit that exposure and access by limiting the sale of tobacco products to tobacco stores only. Our guests joining us this time are State Senator Bob Wieckowski, who is the author of the legislation from Fremont, the 10th Senate District, also the chair of the Senate Environmental Quality Committee. Welcome. Glad to have you.
Thank you for having me, Brian.
And you have brought a guest, Dr. Natasha Nakra. She is the Clinical Assistant Professor, Pediatric Infectious Diseases at UC Davis Medical Center Children's Hospital here in Sacramento, also representing the American Academy of Pediatrics here in California. Welcome, Doctor.
Thank you very much.
Glad to have you here for your medical imprimatur and perspective on this here today. Glad to have you both. Well, let's talk about legislation dealing with children's access to tobacco. Kind of a perennial issue here in California in the legislature. Been going on for a long time. Everything with the efforts to raise the age for smoking, for removing Joe Camel from the advertisements for the attraction to kids, and yet it's still a challenge. Talk about that challenge you face as a legislator dealing with this.
Well, part of the problem, or part of the focus of this bill, is changing that definition of what retail location means. Because what we do now is retail location allows, as we all know, for a variety of opportunities for people to buy tobacco products. What we're going to do is we're going to narrow that. So we're going to have tobacco stores. So tobacco is only going to be available in tobacco stores. As you're familiar in Europe, tobacconists, you see the sign, and we're going to limit the people that can go there to 18 years and older. So the access or the exposure that young folks are going to have, particularly adolescents, when you go into a 7-Eleven or you're buying gasoline or you're going to the grocery store, all that's going to go away.
And I think from a tax perspective, it also streamlines tax collection and enforcement by the Board of Equalization. I know they deal with a lot of tax evasion on this issue, millions of dollars every year, right?
Yeah, tens of millions of dollars. It's like over $200 million that they don't collect from people for some reason. It just leaks out of the system. So by narrowing the locations that it has, we believe that not only will we save the Department or State Board of Equalization money with the enforcement, because they have less people to go to, but it'll actually be an increase because they'll presumably do a better job with more people on a focused area.
Well, I know there's statistics, 40,000 deaths in California, 90% people starting before age 18. Here in a state that we have the second lowest smoking rate in the U.S. I guess, Doctor, do those statistics mirror what you see as a medical practitioner?
Yes, absolutely. I think we commonly see that people start experimenting with tobacco in their teenage years before the age of 18, even though that's the age at which they're supposed to have access to tobacco products. And a lot of adolescents don't realize how addictive it can be. There are statistics that actually show that it's more addictive in adolescents than it is in adults. There's something about their brain development that makes them particularly susceptible to addiction at that point. So often what seems like something that can be just recreational ends up becoming more of a habit and can become a lifelong habit. So can have long-term life consequences for those teenagers who choose to start early.
Well, what role does the psychology of this play into your work as a medical practitioner? I mean, do you see young people who even tell you, or do you see them mimicking those around them who smoke, or falling prey to this look of Joe Camel, or even the secondhand smoke? What role does that play? Do they ever actually tell you that, the young people that are dealing with this?
I think it can be difficult for them to exactly pinpoint what is motivating them to smoke. And so when I ask them that question, a lot of times it's that their friends are smoking, that adults around them are smoking. They think of it as a commonplace thing, not a big deal. And so it's hard for them to know exactly what is motivating it, which can also make it hard for them to know how to stop. When they see those behaviors mirrored in so many people around them.
The non-professional would say kids want to be cool. I mean, that's how it was when I was 16 years old. It's that projection that I'm cool. We see it in the media or the films that we come in. Somebody's serious or somebody's gonna is investigating something. They have the cigarette, and statistics are telling us that 90% of kids people that are smoking started when they were under 18 years old, which is just frightening. Interesting, Brian, is Stanford came out with with a study, and I'm a Cal guy, so this is a little bit hard for me, but it's science. It's science, and they were looking at the advertising of the stores, the convenience stores that adolescents go to versus convenience stores that not a high proportion, and the amount of advertisement that was outside the store, the amount of advertisement that was inside the store, and the shelf space that you had with Marlboro and Camel
Newport
and
was one
Newport is like 3 times more advertising inside and outside the store, and once you're in there having that convenience store experience, which is a special experience anyway.
And this, in fact, is calculated. I mean, this is by design, right?
Right. So this bill hopefully takes all that out. You can have the advertising in the tobacco store with the adults, and we realize that there's going to be on the economic side, there's going to be some pushback from people that are making money selling these products. But the doctor really, she's on the other end, the healthcare side. That we're not. I'm promoting this as it's going to have good positive effects, but we don't know precisely. Is it 10% penetration or 20%? Because that life of smoking has many bad health effects.
Well, Dr. Knocker, elaborate on that. What kind of symptoms, what kind of illnesses related to this do you actually see? And how much is secondhand smoke, too? Because that's a big factor.
Sure. Second and third hand smoke the effects of that are a lot of what I see in pediatrics. So starting from even pregnant women who are exposed or who smoke or are exposed to secondhand smoke themselves, fetuses often show poor growth. In infancy, there's an increased risk of sudden infant death syndrome. And then in childhood, something that I deal with as an infectious disease specialist a lot are children who have recurrent ear infections or recurrent respiratory infections, recurrent asthma, and that's been highly linked to exposure to second and third hand smoke. And I think a lot of parents don't necessarily realize that even if they go outside to smoke, that smoke lingers on the clothes, the chemicals in there can still be breathed in by their children and can affect their health. Then going on to older patients who I don't personally see, but we know that smoking has so many long-term outcomes affecting your cardiovascular health, so risk of heart attack, the health of your lungs, including chronic lung disease and lung cancer, as well as other cancers of the gastrointestinal system, peripheral vascular disease. I mean, the list goes on. You can list so many different long-term consequences of smoking.
We think the number of preventable diseases in California is about $18 billion a year. So again, you look at this and you say we're going to impede kids' opportunity to be exposed to the advertising, to actually get access. I'm not a fool or I'm not childish. I don't think that this is going to eliminate under 18 smoking or under 21 smoking. But it's the idea is that you have some penetration in there with these preventable diseases at the child level, but throughout life is a positive thing. We want to encourage healthy lifestyles.
Mm-hmm. Well, you really are pushing against quite a calculated effort here. I saw a statistic in 2013. The industry spent nearly $300 million on the promotional allowances to the tobacco retailers, the placement of the signs, the provocativeness of the signs, encouraging the purchase of tobacco, cueing the cravings, even undermining the quitting attempts. So, I mean, this is calculated by the industry, with all due respect, to really go after them. So, for all the prevention, the treatment that you do, you're really fighting against a huge wave coming at you.
Well, I'm, again, not totally naive. I understand that that's going to go on. I assume that these tobacco stores are going to be filled with these, provocations and displays, and that's how it is. My point is that to the general public in the grocery store, when I go in there and I'm buying a lot of other stuff, we have those displays also. And again, it's the children that come see that will be seen by Dr. Knocker. It's trying to help out a little bit, Yeah.
And I know locally there's already been some success stories. A lot of local jurisdictions here in California have issued their own anti-smoking ordinances and sale, and even CVS drugstores. Is that right? They've banning them. So you're already seeing something here going on in California, right?
Right, and we like for people to play follow the leader. We think CVS is a champion here of saying we're selling medications to people to help make them well. We shouldn't be selling cigarettes, and I think that's Whenever you challenge the status quo, you have these pushbacks where people, when in my lifetime, in our lifetime, we would have said, you're not going to smoke on an airplane. You're not going to be able to smoke at work. You can't smoke within 25 feet. Some cities are banning it. You're not supposed to smoke in a park or something like that. People are saying they're always after us, and we've watched the numbers decrease, and the healthcare responses have improved.
SB 1400 passed out of policy committee recently. No registered opposition that I noticed, but what is the retail industry saying about this? Are they saying you are helping us from getting into this ethical, legal pit with young people, or are you taking a cash cow away from them?
Well, there's a special session on healthcare,
Right.
and there's a group of bills that were aimed at the tobacco industry. I think their attention is on those bills because that hasn't been finalized yet. They're still enrolled and they haven't been signed by the governor. So I think their attention, they're not ignoring me, but I don't think, I haven't seen the full opposition yet, which will come.
One of the concerns about the bill was that was how it dealt perhaps with mobile vendors. Reading some of the analysis saying that catering trucks and lunch wagons could reclassify themselves and then start selling this.
It was an interesting analysis from the committee that because we worded it and we gave the retail businesses this definition, if they sold 60% of their products were alcohol, not alcohol, tobacco, then that would be an allowed use. And I'm just, I sort of had to smile thinking, I've never seen a mobile cigarette truck. But that was one of the things, sometimes we here in Sacramento, we're litigious and we look at problems and we say, really, if that happened, then we would stop that. Obviously somebody would stop it. I can't imagine somebody thinking that would be a business avenue, but.
Well, the new thing, of course, obviously, is the e-cigarettes. And I know that your bill doesn't affect those because they are not yet classified as tobacco. Perhaps the special session legislation will classify them. But how, this is the uber provocative thing, the thing now that young people are going to away from the tobacco. Speak about that, Doctor, about, your pushback against that industry, your advocacy to your patients about something that's totally different, but from what we understand is just as dangerous.
Sure. I think there's so much misperception about what the risk is with e-cigarettes. I think teenagers have it in their mind that they're not going to have any ill consequences based on it. There's so much acceptance of it. It seems cool. It seems exciting. It's really sort of becoming, I think, a gateway into eventual cigarette use. And it's really hard to get through once someone has already started using because nicotine is so addictive, because there's so much perception that it's, the cool thing to do. I think primary prevention is really going to be the most important thing. So stopping the sales of tobacco first with this bill and later further attempts to curb the sale of e-cigarettes. I think that's really where we need to start because once somebody becomes addicted, it is so difficult to stop at that point. Even parents I know whose children suffer from recurrent infections, they want to quit, and yet it's so difficult for them. They often will avoid having that conversation with me because they feel guilty. But it's just the chemical is so powerful that it can be really hard for them to stop.
Any perspective on that?
Well, if the governor signs the definition of e-cigarettes as tobacco products, then they would come underneath this bill. So that would limit the sale to the tobacco shops. So, there'll be less exposure. Now it's in every store. Every store you can go to, you can buy cigarettes. So I think it's a modest step, but we'll see as the legislation proceeds. And the debate goes on. I think there's an interest in California with the legislature about, these are preventable diseases. These are restrictions on people's activities. We're defining it as an adult activity. Now we've raised the limit to 21, right? Mm-hmm. So we're saying it's really, we want to change people's behaviors, and we want to, with the doctors, assistants in the healthcare industry, get people to make better choices.
And just as the ducks start to line up here with your bill, perhaps opposition, and reflect a little bit more on just the continued persistent opposition, and again, with all due respect to the industry, they're not here to defend themselves, with a lot of the legislation over the last few years, and even this year, the pushback that you get. I mean, how do you feel fearless in the light of it, or how do you handle
I mean,
that?
it's another piece. I mean, I look at, each debate is different, whether we should limit tobacco products to 18-year-olds or 21-year-olds. We still use the same statistics. We know that these are preventable diseases. We know that they're highly addictive, and we also know that young teens start smoking and become addicted. I mean, I knew a guy who was 37 years old that first started smoking. I mean, that's like the oddball, how did that ever happen? You get through 37 years of your life. So this piece of we're still allowing tobacco sales to occur. We're not saying you can't sell it, making it illegal. We're just saying here's the definition that we have, and we're going to restrict it to these areas, so we'll have more control and hopefully, in the big picture, reduce the opportunity for young people to feel that allure, attraction of what it means to have a cigarette, and be grown up and cool.
And I guess, Doctor, part of the attitude about this is the education. In addition to the pushback and the prohibition, it's the educating young people, educating families, educating society about the dangers, which we've been doing for generations, but still.
Yeah, I mean, you still have to be pushing that message forward again and again, and there's only so much that individual physicians can do on their everyday clinic basis. I think legislation really makes changes that apply to the population at whole and can make larger impacts than an individual physician talking to a family, which we will continue to do as well.
Is it an odd thing for you as a young physician into practice now, recalling that a few generations ago your peers were advocating as cigarettes, they're refreshing, they help ease stress, Doctor so and so. I mean, that must be sort of an odd juxtaposition for you in the profession you're in now.
Absolutely. I mean, when you think about when the Surgeon General first came out with a warning to not, that cigarettes may be dangerous for your health. At that point, there was still a question, and now there's so much obvious evidence that it is dangerous to your health. And I think some people are still taking some time to come around to that idea, or they know and it's hard to quit.
Well, final thought for you before we pass.
It's just we have a national effort to reduce tobacco consumption. This bill is just a modest step here in California to limit the exposure to children and to limit the advertising that they see.
Well, good luck with this as it moves through the legislative process. Hope to have you back again to update on this and other legislation you're working on. So,
thank you, Brian.
Thank you, Senator Bob Wieckowski from the 10th Senate District in the Bay Area, and Dr. Natasha Nakra from the UC Davis Children's Hospital in Sacramento. Thank you so much, both of you, for joining us here for the program. And that is this edition of Senate Spotlight. We invite you to join us next time around as we discuss important legislative issues such as this and policies with the newsmakers and newsbreakers of the California State Senate. From the state capitol here in Sacramento, I'm Brian Green. Thanks for watching.
Thanks for watching Senate Spotlight.